And welcome back to First at 4. From an investigation into possible election meddling to what should be done with health care, there seems to be some big battles going on in Washington.
Sometimes it's hard to truly understand what's happening in D.C. So to help us with all of that and figure out what we need to know is 1st District Congressman Jeff Fortenberry. Always good to see you.
Thanks for having me. Good to see you again.
Yeah. So you've been busy with some town hall meetings, right?
Yes. They've been very good discussions. Sometimes tense, sometimes difficult, but very important. You know, some members of Congress don't even do this anymore because of safety concerns for themselves, for the public, and sometimes discussions are just not fruitful, so they're foregoing. I refuse to believe in Nebraska that we can't continue to have a conversation, even when it's difficult, about hard things. And as you mentioned, the predominant topic was health care. And there were a lot of questions, a lot of concerns, lots of differing ideas. It's important for me to not only represent the people who have given me their authority in Washington, but to come back here and give the reasons as to why I'm making the judgments I'm making, but also to learn from people and listen to them.
Congressman, where are we on the health care debate? For those who maybe aren't always watching the news every day, where are we right now?
Unfortunately, we have a very broken healthcare system, and it's very important that we all work hard to get this right. The current law is helping some people, but it is also hurting others, and therefore it's not fair. I think the goal continues to have to be lowering cost, improving healthcare outcomes, while protecting vulnerable persons. If that continues to be the goal, and at this point it's time for both Republicans and Democrats to own this together and look for the overlapping areas in which we can actually get a few things done to stabilize insurance markets. Some people are completely priced out of this market, so that's not helpful at all. There's about 30 million Americans who don't have health insurance because they're either paying the fine or just have walked away from it because it's so unaffordable. And at the same time, holding harmless those who have actually received some help so that they don't feel like they're vulnerable to any changes. But doing nothing is not an option here. Healthcare, it's understandable that this is so sensitive because it's very personal. It's about your own well-being and those who you love. So working hard to get this right, trying to govern rather than rule, as one constituent told me, I think is the way forward here.